Hi everyone, happy Friday. I hope you're all healthy and doing well. Thank you for joining us today for this session on building resiliency to isolation and loneliness. We're really grateful to be able to provide you all with some practical tips to increase resiliency, especially as we're all facing the COVID-19 crisis right now. My name is Emily Scahill. I'm the manager of peer advocacy supports and services at MHA's national office, and I'll be moderating today's webinar. Our presenter today is Patrick Hendry. Patrick Hendry is MHA's Vice President of Peer Advocacy Supports and Services. He has worked as a mental health advocate for the past 29 years. His areas of expertise include peer-provided services, self-directed care, organizational development, and management and sustainability. He is the former executive director of the Florida Peer Network and has assisted in the development of numerous peer-run programs and organizations. Patrick is a strong supporter of the inclusion of mental health consumers in all aspects of the behavioral health system. Some notes before we get started. We are recording this webinar and we'll send that out along with the slides afterwards, so no worries if you miss anything or have to step out for a bit. We've also built in some time for a Q&A at the end. So in your start meeting window, there's a chat bubble, which you can click on to open up a messaging window if you haven't found it yet. So feel free to drop any questions in there and we'll go through some at the end. And if you have any tech issues, toss them in there and I'll help you get that sorted out. So with that, I will turn it over to Patrick to get us started.
Thanks, Emily, and I want to welcome you all to the fourth in our series of webinars that we've done that kind of revolve around what we're all experiencing with the COVID-19 crisis and trying to provide some practical skill-building tools and ideas for consideration that can be used by peer specialists, could be used by anyone who works in behavioral health, and can also be used by individuals. So all of these webinars that we're doing in this series, as all of our webinars are, will be available online, and you can use them with your staff. And I think that there's material in here that each of you can not only apply again to the people that you serve and maybe trainings that you do, but you can also apply to yourself. So first slide, please. So what we're going to talk about is psychological resiliency. And simply put, it's the ability to mentally or emotionally cope with a crisis and to return to a pre-crisis status quickly. It's a lot more complex than that. Resiliency is an amazing concept when you think about it. You almost can't talk about recovery without talking about resiliency. And you almost can't talk about resiliency without talking about recovery because the two things fit very well together. Next slide, please. So if we really look at the nature of the crisis and what everyone in this country and around the world is facing, I mean, this is a unique time in modern history. We've never faced anything quite like this, where not only are we going through the fear of infection and the fear possibly of death of ourselves or our loved ones or people we work with, but we're also having to necessarily experience the pain of isolation and social distancing and quarantining. And because of that, many people are not able to go to work. Consequently, a lot of businesses are having to lay off people. Some businesses are even shutting down. So we have that fear of losing our jobs. We have this greater fear with the economy beginning to slow down that we're going to have a recession. And then there's over all of this is the fear of the unknown, because as I said before, this is not an experience we can equate to anything we've ever done before. You know, you can look at disasters, you can look at 9/11 and see what it did to the world, and it changed the world certainly. But the whole world didn't go on lockdown for a prolonged period of time. We can look at all natural disasters and see similar things. And then we can look back in history at some of the real pandemics that happened before, and some of them were incredible in that they killed a major amount of the population of the entire earth. But at those times, we didn't know the concepts of public health, and isolation is one of those fundamental concepts when you have an infectious disease. And that's why we're all going through it. And it isn't that we're going to stop the disease completely by isolating and maintaining social distance and all that. But what we hope to do is slow the spread of it so that it doesn't overwhelm our healthcare system. Next slide, please. So let's go through each of these things that really create fear in all of us. And the first is fear of infection. And, you know, we know that some people are at higher risk for infection, and those are people who've had prolonged or unprotected contact with someone that we know has the virus already. And that's why, you know, we try and say, you know, stay a minimum of 6 feet away. There's some research coming out right now that shows it might be necessary to even increase that distance, that actually sneezes and coughs can spread particles of the virus even further than we were counting on before. But for now, it's the 6 feet. We also know that people who have, have been in an area where there's a real prevalence of the virus that's active, for instance, in the New York area. And early on, you know, we stopped flights in from China, and we see what happened in Korea and then Italy and then Spain. Now, currently, the United States has the highest number of people with the infection. So far, we're maintaining our the rate of death because of the infection at a fairly low level compared to some of the other places. But we're nowhere near the peak of the infection yet for us, so we don't really know how this is all going to play out. So that then brings about the fear of death, and we know that some people are more risk for serious outcomes. We know that older adults over 65 are considered a high-risk group. People who have certain chronic medical conditions like chronic lung COPD, or moderate to severe asthma, heart disease with complications, so people's circulatory and pulmonary systems aren't as strong as they could be. People who are immunocompromised because of treatments perhaps that they've received, like with cancer treatment. Almost everybody's immune system is suppressed during chemotherapy and even radiation. And then people who are severely obese. And this is because in obesity, and this is particularly of account and seriousness to what we all do, which is we work in behavioral health, and we work with people by and large who have mental health diagnoses, and most of those people take some forms of medications. Some medications work very well for many, many people, and they're happy to take them. But virtually all the medications that we do take, and I'm a person who takes medications, have other consequences. And one of those consequences is very common is severe weight gain. So, and then the other thing that contributes to it too is that people with a mental health diagnosis frequently end up in poverty. If you are no longer able to work or you became ill at a very young age, many people have their first episode in their teenage years and consequently never get a career going, never finish maybe their education, never learn a lot of the skills that people need to live successfully in society. So we have a lot going against us in those terms. And because of that, a lot of people end up on either Social Security disability, which is for someone who has had a work history, and so they get disability income, which tends to be a little bit higher, and with SSDI comes Medicare. But most of the people in the public mental health system eventually end up on SSI. And SSI, Social Security Supplemental Income, is very low, and I'm not sure of the exact figure anymore, but it's somewhere around $760 or so a month. And that's the amount of money they have to live on. And they're not even allowed to receive income from other places without it affecting how much they get in SSI. I believe the last time I looked at it, you can receive $60 a month, and it has no effect on your benefit. But after that, it begins to have an effect unless you're in a return to work type program. And then people on SSI get Medicaid. And that's kind of a double-edged sword in itself, because the fear of losing Medicaid and not having some type of health care insurance or benefit beyond that keeps a lot of people on SSI. So consequently, we have just a really high number of people living in poverty. And some of the consequences of poverty are that people have health issues that are not fully addressed. People, as I said, there's a high rate of obesity and heart disease and diabetes and COPD. There's people with diagnoses for a variety of reasons have a higher rate of smoking than the average population, creates even new problems. So we have all of these things going against the people that we serve and ourselves if we're peers and you know, have these same experiences. Next slide, please. So the other thing that we face, and one of our fears, is that we face the pain and anxiety of isolation and social distancing. You know, lockdowns, curfews now, social isolation are being imposed on communities across the country. Very soon, I think every state will have what they're referring to as a lockdown. It just means that you can't go out except for certain agreed upon circumstances, and that would include certainly going to get groceries or for medical care or going to, you know, pick up prescriptions at the pharmacy. And then there's a number of other things that people are allowed to do, and one of those is recreation, which gives us a lot of leeway. And I would very much encourage, if you're working with people who are experiencing difficulty with the isolation, either they live alone or perhaps they live with a roommate, but they're still not used to not being able to go out and do the things that they like to do and perhaps, you know, have coffee with friends or go to somebody else's house. Right now, those things are not allowed in many, many states, and eventually I think in all states. So what you want to do is give people other opportunities of ways to address these things, and we're going to talk a little bit more about that. You know, people, mankind is hardwired for social contact and social connections. In fact, there's been recent research in the last decade or so that when we experience severe loneliness and isolation, we experience it in the same centers of the brain where we perceive pain. So we actually refer to the pain of loneliness, and it's an accurate description. Anybody who's ever really experienced severe loneliness knows that it leads to anxiety, it leads to depression, and it also suppresses many of the things in our physical health so that we become more inclined to catching diseases just from the experience of loneliness and isolation. So in all these ways, isolating people serves a good purpose in terms of, you know, the contact to spread the virus, but in some ways, if people don't have outlets for those feelings of loneliness and isolation, then we may actually be increasing the number of people who are vulnerable to infection. Personal contact is really, really valuable in our culture, and it's precious to most people. Now, personal contact doesn't mean for everyone physical contact, but there are those of us who really, that is our natural way of relating to people. You know, people who like to hug, people who, you know, will just touch your arm while they're talking to you. You know, some people that's very important to. I was talking to a friend of mine who is a national advocate, has been on the scene for many, many years, and she lives in a senior living facility in North Florida, and she, you know, they're not being able to socialize in the same ways that they were before, but they're not completely isolated. But for her, one of the things that she just misses, and she feels it as an ache, I think, the way she described it, is the ability to touch people. She believes in touching. That's part of personal contact for her. So these are other things that, you know, things like that we're trying to figure out, how do we replace it? We're having to learn a whole new set of skills about how we what is our place in this new world we're experiencing? How do we thrive as we go through it? How do we overcome these negative aspects of what is supposed to be keeping us safe? Next slide, please. So a very real fear for many of us is the fear of losing our jobs. Now, I think in behavioral health, it's not going to be as bad a problem as it is in many other things because people still need care. But care is being provided in different ways than normally. Right now, if we look just at the economy, unemployment rates are soaring. They just announced last 2 weeks unemployment applications, and it was over 6 million. So in the last 2 full weeks, we've lost over 10 million jobs in the economy. We've never had anything like that. The last reported ones was 10 days ago. For the previous 2 weeks was around 3 million, I think it was, or 2.5 million, I believe. And that was the highest rate ever. In fact, the highest rate before that had been somewhere around 700,000 jobs lost in a 2-week period. So we're now at 6-point-something million in this period, 10 million total, and it's still happening. There's estimates out there that we may at some point have 30% of our population unemployed. Now, there's been some things done to try and alleviate some of this burden. There's a $2 trillion CARES Act, which has been passed, and this is going to provide for extended unemployment payments for a longer period of time and a higher amount of money. There's also incentives to employers to keep employees on the books, and if they do, some loans can be interest-free, or some loans can even be totally forgiven at the end, money coming from this CARES Act. So, but unemployment is a real fear, and we're going to talk a little bit about how we face, some of those things. And then the fear of a recession, and this too, it's very real and it's very likely. The CARES Act, the biggest act ever in terms of the amount of money being provided, $2 trillion. We've never even had a single act that accounted for half of that amount. But we also know it's not a stimulus package, so it's not there to get the economy back up and running. It's really there as a disaster relief. It's to try and keep things from falling apart even more. So there's funding for health care, there's funding for individuals, there's funding for companies that can maintain employment, there's the ability for funds to be made to maintain extremely important industries and all of that. But again, like I say, it's not a stimulus package like we had in 2009 where the economy needed to be kick-started back. Again, we're not at that point yet. We're just trying to get through the crisis. So additional funding is going to be needed, but that's what people are talking about now. The Senate and the House are both working on this idea, and in all likelihood, there will be additional funding. Next slide, please. So then probably the biggest fear that we face is the fear of the unknown. And there are so many things that are unknown about this. I was reading one article that said that fear of the unknown may be the fundamental fear that underlies all of anxiety, or the primary fear that underlies anxiety. And H.P. Lovecraft, an author, had this quote, "The oldest and strongest emotion of mankind is fear, and the oldest and strongest kind of fear is fear of the unknown." And that's what we're facing right now, because we can't say from day to day, what's going to happen. We can't say when treatments will become effective. We can't say when, vaccines will be developed. We can't say how long this emergency crisis is going to last. So it's all these things that nobody is able to give a definitive answer to. And that creates an anxiety that is just really pervasive in society. It can, fear of the unknown can be defined as the tendency to experience a fear caused by the idea that there's an absence of information at any level available to us. And see, that's not really true. There is information available. We have to be very careful about the information we take in because there's too much information available. You know, one of the things, and I'm going to talk a little bit more about it later, but you know, one of the things we have to be careful in our own lives, but also with the people that we serve, is to make sure that people don't just follow the news hour to hour, minute to minute, because the news, of course, tends to report largely things that are going wrong. And so there are many things going wrong around the world. There's always been many things going wrong around the world. But if you listen to all of those individual detailed stories, it feels even worse than it is. We need to find news sources that we trust, and I would suggest that it not be social media. I think that there are other ways to get it. One of the ways to get really probably the most up-to-date and accurate information on the virus and the crisis around it is through the Center for Disease Control, CDC. And then, you know, people pick maybe their favorite news outlet. There's newspapers, there's television stations, there's radio shows. You know, we pick what we like, but don't inundate yourself with news. I apologize if any of you can hear the noise in the background. There's somebody outside my window doing lawn work, and so it's a little irritating. But isolation exacerbates the fear of the unknown. So when we're there all by ourselves, you know when you're worried about something, very worried, you're going through a period of anxiety and maybe even depression, and it's late at night, you can never think of the right answer to a problem. You know, it always eludes you in those dark hours. Well, isolation makes you feel that same way. It's a very similar thing. There's no one to reach out to. Consequently, we have to figure out how to do that. Next slide, please. So, you know, what exactly is psychological resilience? And we had, you know, just a brief definition at the beginning. But resiliency is our capacity to draw on our inner strengths that help to rebound from a stressful or traumatic event. As much as it involves the ability for us to bounce back, we always talk about resiliency as the ability to bounce back from adversity. It also can be a time of real personal growth. And so we did a webinar yesterday through another organization on peer support for peer-informed traumatic support for people victims of trauma, and we also talk about post-traumatic growth. And that's what really we're talking about here, that resiliency in a way does give us the ability to learn from what we experience and then find ways to grow as people going through it. When stress or trauma hits us, we experience a whole range of emotions and feelings, anger, grief, and pain. But resiliency is that thing that allows us to keep going, physically and psychologically. And that's why, you know, many people can experience tremendous amounts of real traumatic events, and they continue to fight and continue to work to resolve it and continue to give their strongest effort to resolve the problem. You know, I think back about some of the things that have happened in mankind, and if you think, you know, World War II and the concentration camps in Germany, and the people who were going into these camps knowing that there was a high likelihood that they were going to die or that their family was going to die, but they didn't give up. You know, they did some amazing things in those camps, and people throughout history have been able to do this kind of thing. It's not about how tough you are as an individual. It's not about how stoic you are, which is, you know, the ability to be strong and not show your emotions in a crisis. And too frequently, we think of that as being very valuable, you know, that we stand alone, that we're strong enough to face our problems on our own. And actually, that's not the best approach to things. It's about using the appropriate strategies to get our goals, to meet our goals. Even if it means that we have to reach out and ask for help. That's not a weakness. That's actually a very strong thing that we can do. for us to admit that we need help and to get the help we need is the wisest course of action in many cases. Next slide, please. So people can be resilient even when they are living with a serious mental health disorder. And we know this because we talk about resiliency and recovery together. You know, we have tried for many years to really understand exactly what it is we mean about recovery in mental health. You know, recovery, the concept of recovery existed in substance use for decades and decades before we ever started using that word recovery in mental health. And it really started to be used on a large scale in the mid to late 90s. And there's been a whole lot of definitions. SAMHSA certainly has definitions for recovery. But what we've really tried to figure out is what are the things that have helped us recover the most. And I know I spoke about this in the last webinar, but you know, in those first few years when we started using it and we wanted to know what people attributed their recovery to, we did a series of surveys. And when I say we, there were a number of peer-run organizations around the country that joined together to survey people. I was working in Florida at the time and doing peer support work, and so we sent surveys around a lot of places in Florida, a number of drop-in centers and community mental health centers. And the main answer we got back from almost everybody for 3 years that we did this survey was having at least one person who believes in you, one person, you know, one friend, one person who has your back. And but beyond that, we still tried to figure out how even does that promote recovery, and why is it that one person who may have the same number of friends that I have, may have the same or similar diagnosis that I have, may have had experiences that are very similar to me, and experiences in the system and life experiences, but one of us is more successful in recovery than the other. What's the difference? And so what we always said was it was resiliency. It was that human ability to bounce back. But the error that we made was that we thought for many, many years that resiliency was something that you either had or you didn't, that you were born with. It was an essential part of who you were. And we're beginning to learn that that's not really accurate. We know that resiliency can also have a tremendous effect on people being able to mitigate the depth of depression that they go into when bad things happen. And situational depression, you know, almost everyone experiences some degree of depression in their life, generally based upon the situations in their life, the events taking place in their life. The problem for a lot of us, though, is that if we experience serious, severe situational depression, it can then go into major depression and be something that we have to deal with perhaps for the rest of our life. So resiliency can have a really great effect on keeping us from going that deep into situational depression and anxiety. Strengthening our resiliency can help us to cope with all of the fears that we're talking about, fears of isolation and everything that we're having to deal with in this current crisis. Next slide, please. So, as I said, resilience is not a personality trait. It's actually a behavior, or it involves behavior and thoughts and actions that we can learn, that we can teach each other and that we can learn. It involves developing the ability to focus on 4 core areas, and we'll talk about them in more detail in a minute. One is connection. As I said, you know, human beings are hardwired for social connections. You know, if you look back at the history, certainly there are people who prefer and do live in isolation, and there's always people that are not meeting the same curve that the rest of us are meeting, and that's fine for them. But human beings as a whole need social connections. We also need to focus on wellness, and we'll define some of that in a minute. Healthy thinking, and again, we'll go into more details. And then also meaning, not only the meaning that we attribute to ourselves and our life, but also the meaning of the events that we're experiencing. Resiliency can really increase your capacity to not only get through, but like I said earlier, to grow from adverse experiences. Next slide, please. So one of the things that we want to do is to prioritize relationships. And that is really important in the crisis that we're now facing. We want to connect with people who are empathetic, so they'll care about how we feel and they're understanding, and who can remind us that we're not alone in our problems. We're not alone, that if we have those relationships, if we reach out, there are people that will help us through whatever it is we're facing. And even though it feels sometimes that they're not there, we now, because of things like the internet and social media, the ability to have a smartphone, if not a laptop or computer of some type, we have all these resources out there that we can tap into that didn't exist previously. So, we can do this at our own pace. A lot of people are, for one thing, they're afraid of technology because they're afraid they're going to make a mistake. But, this is something you can do on your own, and you can do it at your own pace. And there's some simple tools, and we're going to be posting on the Mental Health America website some information about how to do internet searches that are effective so that you can find the topics you're interested in. And we're also going to post some links to some sites that talk about internet safety. Because as we reach out through the internet and through social media, there are some dangers. There are always people who will take advantage of a situation. So we need to be mindful of this when we do it. But as I said before, there's wonderful resources available out there now that we never had access to before. We don't want to completely isolate, even though we are living in isolation. We want to reach out, if it's by phone or through social media or video calling or any other way that we can do what we want to do. I've seen these things on the news and on some of the news-based programs about people in communities. For instance, in Italy, I think it started now, it's kind of worldwide, but they showed communities, these apartment buildings on a street in Italy, and there were multiple buildings, 8, 10 stories high, and all the people would come out at a certain time at night to their windows, and they all sang together, and that was community. That made people feel connected and not alone. And now we see that happening in all kinds of ways. Not only are people doing it live like that. In New York right now, there's a certain time of day when everybody cheers on and applauds the healthcare workers because they've been faced with such horrible working conditions and such a lack of the equipment that they need, that the New Yorkers want to show their appreciation. So again, it's community in its own new way. We can reach out in those ways. I was talking with some peer support people yesterday about how do they maintain the contact with the people that they serve when they can't go and sit down and see them. Now, some areas of the country have always faced those problems. You go to what we refer to as a frontier state or even a rural area in some states. But in states like Montana, where you might have, 200 miles to the next mental health center. So it's really not easy for people to have face-to-face peer support. And so they found ways around it using social media and online chats, and then they moved into online support groups, and there's these community forums that you can join. You can find groups of all different types of interests where you might meet people with similar interests to your own. So we've got to do it. Whatever way that we can, we need to reach out. because we may be having to live in an isolated environment, but that doesn't mean that we have to be isolated from the greater world around us. We need connections. Like I said before, I think personal contact is really, really valuable, and it's precious. And so, people are becoming extremely creative in finding ways to use technology, but also to use, like I said, just the ability to come to a window. So when I was talking to the peer specialists yesterday, we were talking about they worked with a lot of people who lived in group homes. And, group homes right now are very difficult environments to be in because it's hard to maintain social distancing in a house with a lot of people, and particularly, many group homes where you share a room with someone. But they're doing the best they can in most places. But they do isolate people from going out and going to see their friends in the community and things like that. So some of the peer support people and even some of the clinical people have been going to the group homes and talking to people through the windows. And where they couldn't talk through the windows because maybe they were, double pane or something, people have brought banners and signs just so that the individuals in those homes knows that somebody's thinking about it. And they bring personal messages. And I've seen in some of the senior living facilities, particularly the nursing homes, where there was a lot of infection rates in the beginning, particularly in Washington State. So family members and outsiders are not allowed to go into those facilities now because it's a place that if you introduce the virus into it, it can have horrible consequences. But family members, I saw this one man who came and he brought a chair and he sat outside his father's window at the nursing home and they talked through the glass and they shared and they even played games together. I think the footage I saw, they were playing cards. But, use your imagination, use your creativity. There are ways to connect to people, and it's so important, especially for those of us who are in helper roles. And not only does helping other people, provide a wonderful benefit to society, it also helps us. Who doesn't feel better when they help someone else to feel better? Next slide, please. So again, we want to prioritize relationships. So, like I said, if we can't use our normal means of contact, then we get creative and find these other ways to do it. One of the things that's really important is to set up regular communications. Routines are something that sometimes we feel like we're falling into a routine and our life is the same every day, and that feels like it's not good. But when you lose all of your routines, when your life gets turned upside down and you were used to, going out, meeting your friends at a rec center or going for coffee or going to somebody's house certain times a day, or you had daytime activities and night activities, and now that's all switched around, we feel that loss of routine. So if we can set up regular communication, particularly with people that we're serving, and set up routines and help people to set goals for each day, and we should do this for ourselves. We set goals, and then when we achieve those goals, we feel stronger. You can also join a group, a virtual group online. There's groups forming all over the United States to do any number of wonderful things, whether it's collecting, food for food banks and then, dropping it off in a safe way. People who are, helping other people financially. There was 2 weeks ago, there was a thing on the news about someone in a restaurant left a $10,000 tip because they knew that that restaurant was about to close and all those employees were going to lose their income. If you've ever worked as wait staff or, any type of staff position in a restaurant or fast foods or whatever, you live hand to mouth primarily. I mean, some people may have good days where they make a lot of tips, but right now that's all being turned upside down. So just think about that. Somebody who just thought that much of the people in their community and they also had the ability to leave a $10,000 tip. So join a group if you can. So like I said, it can be a group that is purely social, gets together just to socialize and talk. Our organization, Mental Health America, we've started a couple of routines. We already had a number of employees, and I'm one of them, who has worked remotely for years. I'm just about 6 years I've been working remotely. Our office is in Northern Virginia, and I used to work in that office. But I now live in Southwest Florida, so I work out of my home, and then I travel a lot, which is changed right now for me. But we've also now, all of our employees are working from home remotely. And we're seeing that people who are new to this, they get lonely. And it affects their ability to work. So we've been having these regular video meetings. And some of it's to discuss the work of the organization. And then on Wednesdays, we have the remote team meeting. And it's really just to socialize. How are you doing? How are you doing through this crisis? What have you come up with? What are you doing for fun? And now our organization is having virtual happy hours at the end of Friday afternoons. And everybody gets together kind of like you might, with everybody from an office or a lot of people from an office going out maybe to have a drink, maybe just to get together. But my son works in a software company, and he works with a bunch of other engineers, and they're programmers, and their team gets together every day to have a virtual lunch, and they each have their lunch, and they sit at a table eating their lunch, looking at each other on video, and just talking, just chatting. It's not about work, it's about connection. Next slide, please. So some of the things that we can do to build it, one is practice mindfulness. So, anything that we can do that makes us be in the moment and appreciate the world around us. Journaling, spiritual practices, whatever that means for you, meditation, all of these kinds of things can help us to focus on the positive parts of our life instead of letting our mind go where it's kind of being led to by this feeling of loneliness and impending bad things happening in the world. Do anything you can to kind of center yourself in the moment and to tap into those stronger parts of yourself. You want to connect to the part of you that remains strong in the face of adversity. We all have inner strengths. They're different from person to person, but we all have some degree of inner strengths. And if we can focus on those when we're experiencing these things, it's much better because it helps us to come up with solutions, and all of this helps us to survive the situation far more effectively. You want to avoid negative thoughts. It's really easy to start thinking negatively, to start thinking the worst, to be fearful about what's going to happen tomorrow or next month or 6 months from now. And because we don't know, our mind really easily goes to like the worst case that it could be, catastrophizing. You want to take care of yourself. You want to eat well. You want to get some exercise. You want to get adequate sleep. You want times during the day. If, for instance, you're working from home, you want to make sure you take breaks and that you treat yourself well, because physical resilience contributes to psychological resilience. So if our body is able to handle what we're going through and we feel physically strong and well, then our mind is even better capable of being resilient. Next slide, please. Learn from your experience. Who has not gone through a major problem in their life that scared them, that was difficult to go through? Certainly any of us who live with a mental health problem, we've had many, many difficulties perhaps in our life. I mean, just even seeking out treatment can be extremely traumatizing. We also, when people are first diagnosed, we're frequently given these messages of hopelessness. You have a mental illness, you're always going to have a mental illness. You have to take medication, you're always going to have to take medication. You'll never work again, or if by some means you do, it's going to have to be something very simple and low stress. That was the message I was given when I was diagnosed in the hospital. And that's like, wow, my life is over. Why do I even bother? It's hopelessness, and that's not the message we want to give people, and it's not the message that we want for ourselves. So we want to go back and we want to look at the things we've gone through and survived, and then we want to figure out how did we get through that. We want to figure out what helped us, what are our inner strengths that helped us face up to these things. What kind of skills did we use and strategies? So skills might be that thing about, using the internet as a way to connect to new people. Strategies might be figuring out, how you're going to order your day so that you're busy all through the day and still getting the relaxation you need and the social contact you need. You want to remember the negative thoughts and actions that prevented you from succeeding in overcoming a previous thing. You don't want to dwell on that. You want to remember it because you want to know that's not the way to do it. That's not my path towards success. And it can be very helpful if you write down your thoughts. A lot of people journal, and it's extremely healthy for many, many people to do that, to just write notes each day about how that day went. Some people journal once a week, however you do it. But write down the positive things so that you can, tomorrow, you're going through a bit of a low period, and then you can look back and go, oh yeah, I remember I told myself to do this. Oh, I know how I felt better yesterday. It was because I called so-and-so. So write down the positives as you experience them so that you can use them going forward. Remain hopeful. Like I said, the message that we receive of hopelessness, that doesn't work. It doesn't help anyone. It doesn't make people more likely to get services. It certainly doesn't make them more likely to succeed in services. We need to feel that there are things we can do that will make our life better. You can't change the past, but you can affect the future. So what you do today affects from here on. What you did before is a learning experience, and you can learn things that worked and you can learn things that didn't work. But you can't change what happened. You can only change what's going to happen. You need to visualize what success and positive outcomes means to you. Like, how do you want, given our circumstances right now, what do you want in your life that will help you get through? And start to visualize it. And when we do that, we're much more likely to create that thing that we visualize. So, always acknowledge good things. Do affirmations. Remind yourself that, you're a pretty good person and that people like you, or, that you've done some very good things in your life. And everybody has some positives, and that's what you have to focus on. Even if you have low self-esteem, you feel bad about yourself, if you remind yourself that your whole life hasn't been that way, if you remind yourself that you've done some good things in your life, and if you remind yourself that you still have the capacity to do good things going forward, you're going to feel much more hopeful, and hopefulness is a major part of resiliency. Next slide, please. Be proactive. Don't shy away from being active. Directly address what's going on in your problems. So, confront your fears, like when you're isolated and alone and you're starting to think all those negative thoughts. Oh, I'm going to catch the virus because, the mailman put mail in my mailbox, and we can all extend our fears in a million different directions. And if we do that, we're paralyzed. So confront those fears and try to use logic, try to use likelihood. We know, for instance, there's 330 million people in the United States. We know that, a certain number of those people have the virus. It's only a very, very small percentage. So the likelihood that on any given day you're going to be especially if you practice reasonable caution, the things that we suggest to people, you're going to be okay. Overcome loneliness by, like I said, by reaching out. You be the person that reaches out. And then you're not only helping yourself, but you're helping the person you're reaching out to. Helping others by maintaining those connections helps us just as much as it does them. In fact, peer support in general is based on a concept, a very simple concept. It was actually called a therapy at one time, but it's the helper principle or helper therapy. And that is that when a person reaches out and helps someone, they are in turn help themselves. And there's been some research in the past. There was a lot of research about this in the 80s and 90s, early 90s, about this helper concept. And we found that people in helper roles actually benefited even more sometimes than the people they were providing help to, because when we help somebody, it really greatly affects the way we think about ourselves. And that's everything. How we think about ourselves is everything. Make your days meaningful. Do things that give you a sense of accomplishment. So if you say that you need a certain amount of routine. I was out walking my dog this morning, and I walked by and there was this woman sitting on a chair in front of her house, and then right in front of her were two children. One looked like about 4 years old and one maybe 5 or 6, and they were doing jumping jacks. And I looked at them and I kind of laughed and said hello, and she said hello, and I said, looks like they got a lot of energy. She said, well, this is gym class. We're having gym class every day because they couldn't be in their preschool, and they have times when they study. And so she set up these routines, and she tries to make it fun for her children so that they have the best experience possible. Do that for yourself. Set up routines, and then do the things. You will feel better about it. Set goals, make plans to achieve them. The thing about when you set a goal and you achieve that goal, you actually become stronger for it. Next slide, please. Try to keep everything in perspective. We can easily let our mind run away with us about all the negatives. And, think about, what you think about and how you think about things. It has a huge effect on how you feel. And if you're trying to make decisions about things and you feel one way about something, but your intellect tells you another thing about it, we're far more likely to go with how we feel. So if we can create positive feelings, then we're far more likely to do positive things and have positive thoughts. Try to maintain a really realistic view of your situation. Don't, like I said, don't fall in the trap of listening to every traumatic thing that's going on around the world. Get the facts you need and then make your own decisions. Like I said, you can't necessarily change what's going on right now or what's already happened, but you can certainly change how you respond to it. Accept change. Change is tough. It is. Good change is tough, but change is a part of life. So accepting the things that you can't change helps you to focus on the things that you can change. Next slide, please. So use events as opportunities for self-discovery. When you overcome obstacles, you can integrate those good feelings into yourself, and it gives you a greater sense of self-worth. Discovering new areas of strength that you didn't even know you had or you just never thought about helps you to grow even more and grow more strengths. Surviving traumatic and stressful things really increases our appreciation of life. Many people say that when they've gone through something extremely scary, extremely traumatic, and they've come out the other side, they appreciate life far more and have a much better outlook on life. Next slide, please. Everybody knows the internet's really running slow right now. So resiliency, as I said before, is a major component of recovery. And the ability to recovery is in part a product of resiliency. So those two things fit together. These two concepts, recovery and resiliency, contributes to the feeling of what is referred to as self-efficacy. And that's when we feel that when we perceive for ourselves that we have the ability to respond to life's demands in effective ways that produce positive outcomes for us. So when we feel like we're in control of ourselves, that what we do affects how we perceive, what we do can make things better for ourselves. When we feel that self-efficacy, we're going to be way stronger when we face a trauma or a event like we're facing right now. All of this stuff is part of what we refer to frequently as well-being. And well-being is a mind and body sense of wholeness and wellness and the ability to move forward in our lives with meaning and purpose. Next slide, please. So resiliency is also now in the research that's going on. It's associated with better health outcomes in later life for older adults and actually increased longevity. So if you think about that, that if we say that resiliency is something you can learn, that you can teach yourself, in other words, you can teach yourself that's going to make something that will make you live longer and have a better quality of life. It means that we have the power to affect what happens going forward. We're not helpless, and we don't need to feel that we're victims of circumstance. Next slide, please. So I really want to thank you, and I'm going to see if Emily's got a few minutes for a couple of questions. I'm sorry I ran a little long. I tend to talk a lot. Emily, do you have some questions?
Yeah, we've got one so far, but anyone else that has any, feel free to pop them in that chat box and we can get to them as well. So the first one, what is the recommendation you have for senior adults that might not have access to a computer or smartphone?
Well, you know, if they even have access to a phone, they can contact, people that they know, but they can also call, for instance, if they were, involved in a faith-based group, if they, went to services and they had a congregation that they were part of. People are not going to church now. Most churches have closed their doors, not all, but most have, because of the danger involved. Call them because those churches are finding new ways to serve people. Call the groups that deliver, groceries. Make sure that you make use of every kind of relationship you have. If you're receiving services from a community mental health center, try to contact your case manager if you have one. If you're getting peer support, contact them. You can call organizations like Mental Health America, and we have over 200 offices around the United States, and you could probably find one fairly easily. And you can go on our website and look up where our affiliates are. Groups like NAMI have offices all over the country. Depression Bipolar Support Alliance is a group you can contact. But you can do those things by phone, and they will put you in touch with other assets that you can access. Because if you can't go the internet way, you can at least use that telephone. And then the other thing I would do too is if you have the ability to, walk outside every day, do that. And if you walk past somebody, yeah, keep the distance away from them, but say hello. Ask them how they're doing, how they're getting through it. Start relationships with people you've never talked to before. If you have a mailman who delivers the mail to your door, not that frequent anymore, but they still do, talk to them. Tell them how much you appreciate what they're doing and that that they're, in a dangerous role because they're out in the community all the time. So take advantage of whatever's available to you. And like I say, if you see somebody on the street, talk to them. Say hi. You never know who's going to be your next friend. Other questions?
Nothing specific, but we do seem to have a lot of teachers and school social workers tuned in right now, asking about how to help, younger kids, teenagers build their own resiliency.
Well, the things that we talked about would apply very well to teenagers, and they're way more savvy about using some of the tools that are going to keep us connected. The main thing with teenagers, you know, you're going through all kinds of changes as a teenager, socially, physically, psychologically, you know, financially, any way you think about it, those changes start happening in that part of your life. And we're also, teenagers right now are experiencing some real deficits, some real losses in the sense that they, you know, they may not be able to go. Proms are canceled, graduations are canceled, and that's depressing and all that. But make sure that they look for things that they like to do. You know, a lot of teenagers are gamers, so, you know, and they have communities of gamers, and so they can reach out through that. But you want, if you have the ability to talk to those teenagers as a teacher or a caregiver, to get them to do those same things we talked about, being introspective, looking at your strengths, building the positive attributes of yourself, having a really good image of yourself, setting yourself goals that you can achieve, because even if it's the smallest goal, even if it's like, okay, I'm going to get up in the morning, I'm going to brush my teeth, I'm going to have breakfast, I'm going to watch TV for a certain amount. You know, if you set those kind of goals and then you achieve them, just that little bit of achievement makes you feel better about yourself, and you're likely to set more difficult goals. Again, like I said, teenagers in some ways have an advantage, in other ways they don't, because, you know, they haven't gone through a lot of life experiences before, so they don't have as much past to draw on, at least most of them. But, you know, talk to them about strengths. Make sure everything that you talk about is strength-based in dealing with the crisis, not about the danger that you're in, but the solutions you're going to come up with. And strategize with them, you know, and get groups of teenagers together, perhaps, for groups that can, you know, kind of a brain trust, you know, getting people together to come up with ideas of activities they can do. I mean, again, a lot of these things that we see online now, these incredible social things that people are doing online, like I saw, I think it was this morning or maybe it was yesterday, 1,000 people went online to sing one song together. And it was beautiful. And they were using Zoom, and they had 1,000 pictures of people up on the screen. It was amazing. And a lot of these things are being done by people, you know, they're 18 years old or younger. So encourage them to do that. Encourage them to reach out to their own friends. And I would also encourage to make sure that they actually converse with those friends, either through, you know, telephone or video calling or whatever they can do, to make sure that they feel that friend is still there and that they're not losing that aspect of their life. What else?
That's about it in terms of questions. But for anyone who isn't in the chat box messaging window right now, there's a lot of really cool resources and tips and tricks, so I'd encourage you to scroll through that if you're looking for ideas. But with that, we can wrap this up. Thank you all for joining. Thank you, Patrick, for sharing with everyone.
Thank you, everyone. I really appreciate you coming to listen, and I hopefully this gives you something helpful for what you do. Take care.
Have a great weekend, everyone.